Our World AIDS Day show would not be complete without speaking with Dr. Michael Harbour, the U.S. Director of Medical Affairs for HIV and Hepatitis C at Merck, the international developer, manufacturer, and distributor of pharmaceuticals. Prior to working at Merck, Dr. Harbour was Associate Clinical Professor of Medicine at Stanford University School of Medicine. Michael, thank you for joining us tonight to tell us what's new in the fight against HIV/AIDS. Is there a pending cure for the disease now that it's in its 32nd year? 32nd year.
It's technically possible, and it's given a lot of people hope and new options for the future. Example of a cure was a baby that had been cured of HIV earlier this year. It's a baby born in Mississippi to an HIV-positive mother. It wasn't known until the time that she delivered that the mother found out that she was HIV positive. So the baby was started on anti-HIV medicines immediately during birth and immediately thereafter. She stayed on the medicines for about a year and a half, but then the mother didn't bring the baby back to the clinic, and so the baby was actually out of care for a while. And during that time, the baby received no more HIV medications. And then when she finally did bring the baby back, there was no evidence of HIV virus in the baby. So during that time, that very early treatment, it was able to prevent full seeding of the virus inside that baby and potentially a cure.
Well, that's great news. So the early onset, early treatment is the way to capitalize on these gains. Is that correct?
Absolutely. That's something else that we've learned. Our Department of Health and Human Services guidelines have been updated to immediately treat somebody with HIV at the moment that we find out that they're HIV positive.
And that's new. Is that in the last year?
Yes. So that is new within the past year. We've always known that you could probably wait. Well, we thought you could probably wait to treat patients until their T cells declined or their viral load was getting too high. But we now know that treating very early on actually helps preserve the immune system and some of the ravaging effects of the HIV virus on the body.
So what can we look forward to capitalize on these new efforts? Are these going to turn into better, easier treatments on people?
There are newer treatments. Thankfully, pharmaceutical companies are still continuing to develop new therapies for HIV and easier therapies for HIV that are more potent, less toxic, and that's great news. And now we actually have clinical trials underway at looking at cure efforts, trying to express that HIV virus that's held in a resting mode, if you will, inside cells, to express it out of those resting cells so the antiretroviral therapies will actually then kill that virus.
Can you talk to us about people who have HIV and the fact that it's an aging population that is aging with HIV?
Sure. So you mentioned 32 years of having HIV around. The people who have actually survived, luckily enough, are now in their 50s and 60s and beyond with HIV.
Does that present other complications besides just the disease itself, the impact of getting older with the disease?
So by 2015, over 50% of the HIV patients in the United States will be greater than age 50. And with aging comes all sorts of other complications, cardiac disease, increased risks for stroke, diabetes. And so we know that many of the patients who are infected with HIV are experiencing a lot of these illnesses. And so we need to manage these illnesses better and hopefully give medications that don't exacerbate those illnesses as well.
Thank you for joining us, Dr. Harbour, and informing us on the most recent developments in the fight against HIV/AIDS. To find out more about Dr. Michael Harbour and his work, please contact him at drharbour@gmail.com or the PACE Clinic at the Santa Clara Valley Center, 408-885-5935. Coming up next, Peter Lee of Covered, California. You're watching Outlook Video.